Thank you. First of all, I sat through your earlier discussions that you had, and I see that you guys are very well versed in the technicalities of buildings, as well as the law on that reform. But what we have before us today is the City Council putting onto you guys a very emotional and very much of a issue that's not necessarily the technicality of, what angle is this drainage going at? And if you don't have the background in it, you can see how everybody's talking about all these very emotional issues, how it's affecting them. If you heard what Leo said, it is the law, it is legal, so that issue should just go away. So what we need to talk about is the zoning. So if we look at the zoning, what you got to figure is they just passed this new law that goes into effect January 1st, which says that possession of an ounce or less is a ticket for $100. Now, you would think that would be a good thing, but the problem is that means that the kids now don't have to worry about going to jail. They just get a $100 ticket. So if you create this buffer zone of 1,000 feet between everything in San Diego and the collectives, then what you're doing is you're creating a buffer zone to protect the illegal drug sales. And we don't want to have illegal drug sales. We don't want to have people who are selling to children out there. The collectives have never, ever been accused of selling to minors. That has not been an issue. They have never done the things that they're saying that is created. So what we have to do is we have to say, okay, these are sick people trying to get their medicine. How far should they have to go? He had one person come up here and said, we saw them out in the parking lots medicating and then getting in their cars. So now you're telling me you're going to put them 25 miles away? If that's your issue, you want them to drive 25 miles when they've done medicating? So that shouldn't be an argument to put them further out. What we need to do is we need to make sure that we have safe access here in the city. We need to make sure it's in the places where people are. Because if you've gone through chemotherapy or if you have issues like that, you don't want to go and try and drive out 25 miles to go get your medicine. That shouldn't be the issue. Okay? And this is not a recreational thing. This is for sick people. That's what we're talking about. So we need to make sure the medicine is where the people are at. As far as the process 4 goes, that's for airports. I don't think any one of these places is going to have planes landing at them. Okay? What we need to make sure of is that we have something that's reasonably priced for the people to go. Because guess what? That goes all on the backs of the patients. And if you're paying your medical bills and you're going through hardship that way, you don't need to be paying a lot of money for your medicine. So I got 2 seconds left. Thanks.
Thank you.